All right, let's jump right in. We're going to talk about systemic sclerosis. You might know it as scleroderma. And for a long time, this has been one of the absolute toughest nuts to crack in rheumatology. But the rule book, it's being completely rewritten. We've got major new guidelines from some of Europe's top experts, and believe me, they represent a huge shift in how we're thinking about and managing this condition.
And this is exactly why it all matters so much. I mean, look at that quote. It's not just some dry statistic, right? It's the reason for this whole update. Scleroderma has the highest mortality rate of any autoimmune rheumatic disease. It's a really stark reality. And that's why getting everyone on the same page, creating a unified, powerful new playbook for treatment, well, it's an absolute game changer.
So what is systemic sclerosis anyway? Well, at its heart, it's an autoimmune disease where your body's own healing system just goes into overdrive. It starts pumping out way too much collagen. And you know collagen, it's the stuff that makes up scar tissue. So imagine getting that scar tissue, but not just on a cut on your skin. Imagine it forming inside your body, in your lungs, your heart, your gut. That process is called fibrosis, and that's the real core of the problem. It's what makes this disease so tough.
Now, to really get a feel for how big a deal these new guidelines are, we're going to look at this through the eyes of a patient. We'll follow their journey, right from the very first signs, through the whole diagnostic process, and now to a treatment plan that's a whole lot more hopeful and targeted. Because this isn't just about the science, right? It's about how that science actually changes people's lives.
So let's start at the very beginning. You know, one of the biggest challenges with scleroderma has always been just getting a diagnosis. It's a rare disease, and the early symptoms can look like a lot of other things. In fact, the data shows that from when a patient first notices something wrong, other than Raynaud's, which is that thing where your fingers and toes get super cold and numb, it can take more than a year to get the right diagnosis. A year. So the big question these guidelines had to tackle was, how do we shrink that delay? How can we possibly close that gap?
And here's their answer. The new guidelines lay out this really clear, straightforward three-step approach. Think of them as the three big red flags. First, you look at the patient's history. Do they have Raynaud's that just won't go away? Second, the physical exam. Are their fingers puffy and swollen? And third, you do some specific tests. We're talking antibody tests and this really cool procedure called nail fold capillaroscopy. It's basically a special microscope that lets doctors look at the tiny blood vessels right at the base of your fingernails. So with this framework, there's finally a clear, actionable way to diagnose it early.
Okay, so a diagnosis is made. What happens next? This is where we see the biggest breakthrough. I mean, for the very first time, two of the heavy hitters in European rheumatology, EULAR and the British Society for Rheumatology, have gotten on the same page. They've aligned their strategies. So now we have one unified, evidence-based playbook for doctors all across the UK and Europe. That's huge.
I mean, just look at the difference here. The contrast is, wow. The old way of doing things was pretty reactive, kind of waiting for organ damage to show up before acting. And there just weren't many tools to fight that core problem, the fibrosis. But this new approach, it's totally different. It's proactive, it's personalized, and there's a whole new arsenal of treatments that go right after the fibrosis itself. We're not just managing symptoms anymore. This is about actually modifying the disease. It's a massive leap forward. So what's the big idea behind this new playbook? It's all built on this concept of therapeutic continuums. Now that sounds a little academic, I know, but the idea is actually pretty simple and really powerful. Basically, scleroderma causes problems that are all connected. For instance, the same issue with your blood vessels can cause Raynaud's in your fingers and pulmonary hypertension in your lungs. See the connection? So the strategy is to use related types of drugs to fight these related problems. It's all about connecting the dots and going after the root cause. Okay, so let's get into the nitty-gritty. How does this actually work? We'll start with the first major battleground, the vascular problems. The easiest way to think about it is like opening up clogged pipes. The disease makes blood vessels get narrower, and that chokes off blood flow to your fingers, your lungs, you name it. So the new guidelines have a really clear step-by-step strategy for getting that flow back.
And here's the toolkit. It's all laid out pretty clearly. For Raynaud's, doctors will start with something like calcium channel blockers. If a patient develops painful digital ulcers, they move up to more powerful options. But the really big news here is for pulmonary arterial hypertension, or PAH. The new recommendation is to go in strong right from the start. We're talking a combination of two different types of drugs, PD-5 inhibitors to help widen the blood vessels, and endothelin receptor antagonists to stop them from tightening up in the first place. This idea of using a combination therapy right away as the first move, that's a huge shift, and it's all backed up by solid clinical trials.
All right, now for part 2. And honestly, this is probably the most groundbreaking piece of the whole playbook. We're talking about the direct fight against fibrosis, that hardening of the skin and organs. For so long, this felt like the one part of scleroderma treatment we just couldn't crack. But that's not true anymore. Yeah, this quote right here, it really says it all. This is the first time we've had a whole set of advanced, targeted therapies that are officially recommended to fight fibrosis in both the skin and the lungs. This isn't just a small update, you guys. This is a whole new era. We're moving past just broadly suppressing the immune system and into therapies that can zero in on the specific things driving this disease.
And here it is, the new arsenal. Now, we still have the tried and true immunosuppressants like mycophenolate mofetil, MMF for short, which kind of dial down the whole overactive immune system. But now, check this out. For both skin and lung fibrosis, there are new targeted therapies. We're talking biologics like rituximab and tocilizumab, which go after specific immune cells. And then there's an antifibrotic drug, nintedanib, that actually works to slow down the scarring process itself. This just gives doctors so many more tools to work with to try and stop that hardening in its tracks.
And what's really key here is how these tools can be used together. The guidelines make a special point about the strategy for lung fibrosis, or ILD. A doctor can now use the antifibrotic drug nintedanib at the same time as an immunosuppressant like MMF, so you get this incredibly powerful two-pronged attack. One drug is calming the immune system, and the other is directly blocking the scarring in the lungs. It's a fantastic strategy. Now look, these guidelines are a massive step forward. Absolutely monumental. But the work isn't done, not by a long shot. The task force was really clear about this. This new playbook is also a launching pad for the next wave of research. It sets a new standard of care, for sure, but it also helps us see exactly where we still need to focus, where the next breakthroughs need to happen.
And here they are, the next frontiers. You know, the patient reps who were part of the committee really pushed for more focus on things that deeply impact quality of life. I'm talking about severe GI issues and those painful calcium deposits called calcinosis. Beyond that, researchers are looking at cardiovascular problems, and of course, they're always working to find even more drugs that can target fibrosis and the immune system. The momentum is just incredible right now.
Which brings us to this final question. For decades, getting a diagnosis of systemic sclerosis, well, it often felt like a one-way street, an inevitable decline. But now, with a unified playbook, a proactive approach, and this whole new arsenal of targeted tools that can fight fibrosis head-on, the entire outlook is changing. The goal isn't just to slow the disease down anymore. The goal is to turn it into a manageable, long-term condition. And that right there is a future that is filled with more hope than ever before.